Hi, my name's Michael Hitcho. I'm the owner of Hitcho Insurance. This video is part of an educational series which I designed to help you save time and money on Medicare insurance by educating you on all things Medicare. Today we're going to look at a question: do I need a supplement to Medicare? It's a great question. To understand whether you need a supplement or not, I think you should have an understanding of what Medicare A and Medicare B cover and what they leave behind, which would be your responsibility. And then we'll look at some scenarios, at least 5 of them, as to a different option other than a Medicare supplement plan, just in case you don't qualify for any reason. Okay, so Medicare Part A covers hospitalization, skilled nursing facility care, and hospice care, but it doesn't cover everything in full. See, if you go into the hospital, you're responsible for the first $1,408, which is called the Part A deductible. Now that number is based off of rates for 2020, the year 2020, and all the other numbers we're going to go over are for that year. So if you're watching this video after 2020, rates are probably higher. So you're in the hospital, you may get through the doors, you're admitted, you have the deductible, the first $1,408. Should you stay in that hospital longer than 60 days, days 61 through 90, Medicare is going to leave behind $352 each day for that cost in the hospital, which means it's your responsibility. Furthermore, days 91 through 150, you would need to use all of your 60 reserve lifetime days, which costs $704 per day. That's a lot of money left behind. Also, should you have to go back into the hospital on another claim that's outside a window period of 60 days when you're discharged, your Part A deductible starts over again. So it really could add up. Skilled nursing facility care, as I mentioned, days 21 through 100, there is a price tag each day. The first 20 days are covered by Medicare, but days 21 through 100, they leave $175 behind each day. That's over $10,000. That's your responsibility. And hospice care, small copayment left behind. Now let's talk about Medicare Part B. This is the medical insurance side of coverage. It's for the doctors, primary care, specialists, physical therapy, speech therapy, diagnostic testing, advanced imaging like MRI, CAT scan, PET scan, the x-rays, durable medical equipment, which is a wheelchair, a walker, oxygen tank. Part B, medical drugs, but drugs that are administered at the doctor's office or the hospital, like chemo, radiation, other services like allergy shot, cortisone, pain management shots. Medicare leaves behind a deductible. The deductible for 2020 is $198. After that, Medicare will cover 80% of the claim and you're responsible for 20%. So now you can see what's left behind. Medicare covers, A and B cover a lot of services, but you can see there's a lot of bills left behind. Now, if, going back to the original question, do I need a supplement for Medicare? The answer is no, you're not required to have one. However, if you don't have the resources to pay those deductibles or copays up front, or if you're somebody who doesn't want to have to worry about coming up with the money later should something happen, you're definitely going to want to enroll into a Medicare supplement and pay for it. There's going to be a monthly charge. After all, you're paying money to an insurance carrier to put the risk on them to pay for deductibles and copayments should they arise from bills that are left behind by Medicare, claims that are approved on your behalf. So definitely would want to look for a Medicare supplement. However, let's look at 5 scenarios in which maybe Medicare supplement's not an option for you. One scenario could be you just don't have the monthly premium, the affordability to pay for a supplement. Another scenario, number 2, you might not be able to pass the medical underwriting for an insurance plan. See, there are certain times, like when you turn 65 or when you go on a Medicare Part B for the first time frame, where the insurance carrier is not allowed to ask questions regarding your health. But outside of those enrollment times, there is no other time period in which you're going to be allowed just to enter into a Medicare supplement without medical underwriting. So what you're going to look for is a carrier that could accommodate you based off of your health. But maybe your health is in such a state that you can't pass anyone's medical underwriting. Therefore, you don't qualify for a Medicare supplement and can't purchase one. A third option, maybe you get additional benefits like from the VA or have TRICARE. Another situation might be that you have saved a lot of money and you could afford all your copays and deductibles, and you don't want an insurance carrier to insure with to cover those. And the fifth scenario would be, what if you're just healthy and feel there's absolutely no need for any additional insurance coverage? Maybe you don't go to the doctor very much, so why pay any money to an insurance carrier? Those are all valid reasons, and if you find yourself in one of those scenarios, I would encourage you to look for an alternative plan, which would be a Medicare Advantage prescription drug plan. Now, I'm not going to get into what that covers in this video. You'll have to look through my series to find what a Medicare Advantage plan is, video, educational piece, but it's just worth noting it here that you might want to look at that for a few reasons. Number one, there might be a zero premium plan in your area, so that addresses the affordability issue. Number two, they only ask one medical question, such as, do you have end-stage renal failure? So if you don't, that knocks out and eliminating all other types of medical conditions. If you have any pre-existing conditions, they will be covered, so there's no issues with that. Plus, the plan might even have prescription drugs. And lastly, what that plan is going to do is provide with what's called a MOOP, a member out-of-pocket maximum. See, as I went back before and told you about everything that Medicare leaves behind, Medicare doesn't say somewhere in the year that, hey, you had a lot of expenses, we see that you had $10,000 worth of bills on your end. Because you reached $10,000, we're going to cover everything else. Original Medicare doesn't do that, but a MAPD plan would do that for you. So there's definitely some value in that if you fall into one of those scenarios. So again, my name's Michael Hitcho. Thanks for watching my video. I am an independent Medicare insurance broker. There's no cost or fee to work with me. I do my best to find clients plans based off of their finances, their goals, their personality. And I would look forward to working with you. If you have any interest, feel free to give me a call at 610-694-9435. I hope you found value in this video and that you have a great day. Take care.